This new and until now unknown virus has killed 4,500 people and infected 125,000 around the world. The outbreak of coronavirus is now undeniably a global crisis and is now officially a pandemic.
We're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
In Italy, the worst-hit country outside China, drastic measures to contain the virus have been extended. All cafes and restaurants have been ordered to shut. With almost 200 deaths today, one doctor describes horrific conditions as patients overwhelm hospitals.
The night was very exhausting, just like all nights over the past 2 weeks around here. We saw dozens and dozens of people of varying ages that arrive at our emergency room manifesting coronavirus-like pneumonia.
Here, 2 more people have died and 83 others infected, the largest jump in one day. One patient is a resident at this care home in Hampshire. Today, the government insisted keeping the elderly safe is their priority.
Adult social care will be at the front line of our response, with social care providers looking after many of the most vulnerable in society. We're working closely with the sector to make sure it is ready.
Although testing is now being ramped up, there are fears hospitals will struggle to cope with large numbers of very ill patients. The UK has half the number of critical beds per person than Italy.
Since 2009, we do have a deficiency of critical care beds, particularly around elective surgery. So we are probably starting from a position of being relatively behind in terms of numbers of critical care beds.
Tonight, 135 Britons who'd been on a quarantine cruise ship in America travelled back by cargo plane. Met by officials in hazmat suits, they headed home to join hundreds of others in self-isolation.